Hi, I'm Corinne and this is Pharma 101. And for today, we're going to discuss antiviral drugs. So we have a case here, as you can see. Discuss the instructions you would include with the patient and family teaching that would be appropriate for patient prescribed with antiviral drugs. Be as thorough as possible. What is viruses? So, a virus is an organism that must reside within a living host cell to survive and reproduce. It is more difficult to eradicate than other bacteria. How does antiviral drug works? It prevents or delays the spread of viral infection, and it also inhibits the viral replication by interfering with viral nucleic acid synthesis in the cell. We have 5 classification of antiviral drugs. So what are they? We have non-classified antiviral drugs, topical antivirals, purine nucleosides, neuraminidase inhibitors, and antiviral HIV drugs. So non-classified antivirals inhibits the replication and spread of the influenza virus or flu within 48 hours. There are side effects and adverse reactions that may include insomnia or inability to sleep, depression, anxiety, confusion, orthostatic hypotension or sudden decrease of blood pressure as a person stands up, slurred speech, nausea or the feeling of vomiting and diarrhea. Applied to a particular place or part of the body are used to treat herpes simplex virus or HSV. We have 2 drugs there, penciclovir and trifluridine. Penciclovir is a cream that is applied every 2 hours for 4 days while the patient is awake. And trifluridine is an ophthalmic solution. Purine nucleosides are drugs that interfere with the steps of nucleic acid DNA synthesis. So, these drugs are effective for CMV retinitis in patients with AIDS. And all of the drugs here are administered orally with the exception of ribavirin and ganciclovir. Ribavirin is administered by aerosol and ganciclovir is administered through IV. Neuraminidase inhibitor inhibits the activity of neuraminidase. It is effective against influenza A and B. Oseltamivir phosphate decreases the release of viruses from infected cells. Zanamivir is being administered through inhalation while oseltamivir is taken orally. Or nucleoside reverse transcriptase inhibitors interferes with HIV viral RNA-dependent DNA polymerase that inhibits the replication of the virus. The dosages in NRTI drugs are being adjusted for people that has renal problems, and all NRTI drugs except for didanosine should be taken with food. When drinking or taking didanosine, they should be taken 60 minutes before meal or 2 hours after meal. And an RTI or non-nucleoside reverse transcriptase inhibitor prevents viral replication by competing with binding of the reverse transcriptase enzyme at the active site. Efavirenz is optimally administered as a component of atripla, given once daily at a bedtime on an empty stomach or low-fat meal to prevent excess absorption of the drug. Nevirapine is used as an alternative for patients that are conceiving or they are in their first, second, third month of pregnancy or for those who are planning to conceive, but it may risk for rashes and toxicity in the liver. There are 2 things that you should remember when taking antiviral medications. First is do not double dose. Pwedeng maging toxic yun sa liver kasi yung liver natin is yun yung nag-absorb ng mga gamot na nasosobrahan. Kaya wag tayo magdo-double dose. And nakalimutan mo yung medication mo for that day gawin mo, inumin mo agad. So, kunwari, yung gamot ko is amantadine. Binigay sa akin ng doktor or pinrescribe siya twice a day yung 100 milligram na amantadine. Ang ginawa kong schedule dose is 8 a.m. and 8 p.m. Ang mangyari, 6 p.m. mo ininom yung first dose na para dun sa araw na yon kasi na mismo nga na 8 a.m. Tapos, yung second dose is 6 a.m. na ng umaga ng kinabukasan. Na siya. Tapos, di ba dapat may 8 p.m. ka pa na dose yung pangalawa. Ang mangyayari, i-disregard mo yung second dose na yon. Kasi kapag ininom mo siya, double dose ka. Tapos, ang sunod mo na nainom is 6 a.m. na. Yun ay para ma-prevent yung double dosing. Yeah, that's all.